Addison disease is a medical condition in which the adrenal glands do not produce enough hormone or adrenal cortical insufficiency. It is known as primary Addison disease because this disease is caused by damage of its own glands that leads to the destruction of the entire adrenal cortex. The etiology, how this gland damaged and destructed, is multifactorial. It can be caused by autoimmune disease. Mostly, autoimmune disease is major cause of Addison disease. Autoimmune disease occur when the body's immune system mistakenly attacks the adrenal glands. Besides that, long-lasting chronic infections such as tuberculosis, HIV, and some fungal infections can harm the adrenal glands. Cancer cells that spread from other parts of the body to the adrenal glands also can cause Addison disease. The hemorrhage also causes Addison disease. The pathophysiology of Addison disease is it can cause decrease the secretion of corticosteroid from the adrenal cortex and increase ACTH secretion as compensation negative feedback mechanism. Specifically, damage of adrenal gland can lead to mineralocorticoid deficiency. Deficiency of this mineralocorticoid result in increased excretion of sodium and decreased excretion of potassium in urine because normally this hormone controls the balance of sodium and potassium. In this case, when the sodium is excreted, water will follow as ADH secretion is depend on sodium ion. ADH is important for reabsorption of water. Thus, the result is a low serum concentration of sodium and high concentration of potassium. Urinary salt and water loss cause severe dehydration, plasma, hypertonicity, acidosis, decreased circulatory volume, hypotension, and eventually circulatory collapse. Meanwhile, glucocorticoid deficiency contributes to hypotension and cause severe insulin sensitivity and disturbance in carbohydrate, fat, and protein metabolism. In the absence of cortisol, insufficient carbohydrate is formed from protein. Besides that, it will cause hypoglycemia and decrease liver glycogen resulted from disturbance of glucose metabolism. In addition, weakness follows due to deficient neuromuscular function, resistance to infection, trauma, and other stress is decreased. Myocardial weakness and dehydration reduce cardiac output, and circulatory failure can occur. Decreased blood cortisol results in increased pituitary ACTH as compensation in negative feedback mechanism when their adrenal hormone is decreased. In normal condition, ACTH will stimulate the releasing adrenal hormone from adrenal gland. However, in this case, ACTH stimulation cannot stimulate the releasing adrenal hormone as the adrenal gland is damaged. So, this gland cannot be respond to ACTH. This causes ACTH will continue rise. Increased pituitary ACTH production and increased blood beta lipoprotein. Which has melanocyte stimulating activity and together with ACTH cause the hypopigmentation of skin and mucous membrane characteristic of Addison disease. Increased pituitary ACTH production and increased blood beta lipoprotein, which has melanocyte stimulating activity and together with ACTH cause the hypopigmentation of skin and mucous membrane characteristic of Addison disease. Decreased blood cortisol results in increased pituitary ACTH as compensation in negative feedback mechanism when their adrenal hormone is decreased. In normal condition, ACTH will stimulate the releasing adrenal hormone from adrenal gland. However, in this case, ACTH stimulation cannot stimulate the releasing adrenal hormone as the adrenal gland is damaged. So, this gland cannot be respond to ACTH. This causes ACTH will continue rise. increased pituitary ACTH production, and increased blood beta lipotropin, which has melanocyte stimulating activity, and together with ACTH, cause the hypopigmentation of skin and mucous membrane characteristic of Addison disease.
Let's move on to the laboratory finding. Based on the laboratory investigation on this patient, it showed that there are some changes in electrolytes level in plasma. In this case, we can see the sodium and chloride show low level in plasma, whereas potassium and urea show high level in plasma. How the changes in electrolytes level in plasma is occur? As we know, this patient has Addison disease where destruction of adrenal cortex is occur. When adrenal cortex is damaged, it can give effect to the aldosterone production. Aldosterone level is low and cause sodium and water loss with potassium retention. Same with chloride, it will follow sodium level and cause low in plasma. Due to the sodium and water loss, this patient become hypovolemia, which is decreased blood volume, consequently increased level of urea in the blood. From the sign and symptom of this patient, it shows that this patient has vomiting, so she will get dehydration. Dehydration is occur due to the loss of sodium and water and also potassium retention. Even though this patient has lost sodium and water, but she still has high level of urea in plasma. This is because this patient dehydrate due to the vomiting instead of excess urination.
Adrenal stimulation test. Adrenal stimulation test is a test that measures how well the adrenal glands respond to the adrenocorticotropic hormone ACTH. Before we begin with the test, let's take a look at this diagram. It shows how the ACTH is in use and function. Human stress causes hypothalamus to secrete corticotropin releasing hormone CRH. Consequently, the CRH activates the hypothalamic pituitary adrenal axis HPA axis. CRH stimulates anterior pituitary to release ACTH, which travels through the bloodstream to the adrenal cortex, where it then upregulates cortisol productions. Adrenal stimulation test is measure how well the adrenal glands respond to the adrenocorticotropic hormone ACTH. ACTH is a hormone produced in the pituitary gland that stimulates the adrenal glands to release hormone called cortisol. The stimulation uses the man-made form of ACTH is called concentropin. Why this test is important? ACTH level in the blood are measured to help detect, diagnose, and monitor conditions associated with excessive or deficient cortisol in the body. This condition includes 5 conditions. The first one, Cushing disease. Excess cortisol that is due to an ACTH producing tumor in the pituitary gland, usually a benign tumor. Second, Cushing syndrome. It refers to the symptoms and signs associated with excess cortisol. In addition to Cushing disease, Cushing syndrome may be due to an adrenal tumor, adrenal hyperplasia, the use of steroid medications, or due to an ACTH producing tumor located outside the pituitary, or ectopic tumor, such as in the lung. Third, Addison disease. It is a primary adrenal insufficiency. It causes decrease in cortisol production due to adrenal damage. The fourth one, secondary adrenal insufficiency. Decreased cortisol production because of pituitary dysfunction. The fifth one, why the test is important, is to detect hypopituitarism, pituitary dysfunction or damage that leads to decrease or no hormone production by the pituitary, including the ACTH production. These are signs and symptoms of Cushing syndrome and Addison disease. How the test is conducted? The test conducted is done via 5 steps. The first one is your blood is drawn, then second step, the lab then checks the cortisol level in the blood sample. Third step, you then receive a shot or injection of concentrophine. After that, after either 30 minutes or 60 minutes, depending on how much concentrophine you receive, your blood is drawn again. The last step, the lab rechecks the cortisol level in the second blood sample. Results: level of both ACTH and cortisol vary throughout the night. Normally, ACTH will be at the highest level in the morning and the lowest level at night. It will stimulate cortisol production in which will follow the same daily pattern. These are the normal value for the cortisol: adult, children, and newborn. After ACTH stimulation, the levels of cortisol in the blood should be more than 80 micrograms per deciliter to 20 micrograms per deciliter. The result shows below the normal range. However, there is an increase in cortisol level few hours after stimulation given. Blood cortisol level below the acceptable range following stimulation are considered low. This indicates that there are conditions such as acute adrenal crisis, Addison's disease, hypopituitarism, or pituitary tumor. In this case, the abnormality arises from Addison disease. These tables are the table of summary of hormones level and disease.
So next we move to the sign and symptom of Addison disease. Addison disease symptoms usually develop slowly, often over several months, and may include vomiting, weight loss, fainting, muscle weakness, muscle and joint pain, hyperpigmentation, hypoglycemia, body hair loss in women, irritability, and also salt craving. So, this picture shows the sign and symptom of Addison disease. Lastly, thank you.